Bismillah ar-Rahman ar-Rahim. In the name of Allah, the Beneficent, the Merciful.
We need to catch our health professionals when they are young. Not that we can't make these interventions at a later stage, we will. And so as a pilot, what we did at Riphah, again to the best of my knowledge, our Faculty of Medicine and our medical school is the first in the country, and all thanks to General Azhar, who's the Dean Faculty of Medicine at Riphah, that we have embedded patient safety curriculum in our MBBS program. So I think that is, and this year, inshallah ta'ala, we plan to embed these modules in our Doctor of Pharmacy program, in our Doctor of Rehab program, and also in our BDS program as well. So we need to create a vibrant, lively National Association of Patient Safety. Dr. Zaki has developed the framework, and we need to activate that, and I hope that each one of you will become a member of that.
The ICPS has led the patient safety journey in the past and continues to do it by bringing experts from around the world. We at CMH Medical College and Institute of Dentistry, Lahore, are proud to play a supportive role by hosting the conference and welcoming all the participants.
The real challenge that we face in patient safety, I think, is not about resources. It's about will. It's about leadership. And this is not a unique challenge to Pakistan, but I'd like to share with you some of those numbers. This picture is a young child who died in Australia when an IV intravenous bag, the fluid ran out, and so the air from the bag went inside the child and killed the child. This happens about 2,000 times a year at least around the world. A simple solution of a one-way valve would prevent this very simple engineered solution. What's very interesting about this is it requires cooperation of companies or private-public partnerships to work with physicians and professional associations to make it clear that these devices allow us to harm, or in this case, to kill many, many patients. In the last several years, there have been at least 9 cases of young people that have died because central vascular lines were removed when they were sitting up. This is 100% preventable, not 90%, 100% preventable. So why are we not learning from these events? That is the real theme of this conversation today. This young man, 21-year-old, said, "I tell my friends, quote, screening in government hospital is so poor, I don't recommend they use hospital blood bank services because they're unsafe." If this is a real or perception, it doesn't really matter. The trust of the public is what patient safety is about. When the public doesn't trust hospitals, then they turn towards quackery. And I've had detailed conversations with Dr. Ajmal, the head of the Punjab Healthcare Commission. I'm very impressed with the Punjab Healthcare Commission. I think it's an anchor of excellence and strength. I'm so glad to hear that other provinces in Pakistan are following its course. This is my message, if I may be so bold and not disrespectful, to the Prime Minister. Just like John F. Kennedy in 1961 said that to get a man on the moon, the entire country must work, from the janitors to the generals. This is what I think Pakistan needs to do. To become a safe country, to become more resilient, you must have the will, the optimism, the investment for change. We can do it here in Pakistan, but it requires a firmly rooted culture and improvement. That means the power of pervasive and constant learning. Not more rules, more love. And that's very, very powerful. Clinicians and nurses respond to that much more than more rules. So we are very, very busy, and so this is a problem. What are we going to focus on? There's so many things. But at the end of the day, I believe that trust is the heart of changing. So if we can build more trust, we can have more truth-telling. If we can have more truth-telling, we can have more transparency. So that, I think, is the secret for that. And I'm going to end by just saying that we are responsible, like the Holy Quran, to be around this. So let's use this power that Pakistan is so careful and thoughtful to drive healthcare improvement in Pakistan. Thank you.
Punjab Healthcare Commission was created, established under a statute for the first time in the history of this region, including the South region countries, Iran, Afghanistan, and as far as I think UAE also. There was no such regulatory body about healthcare service delivery as regulator in this region. Please look at the things in the Pakistani context. It is much easier to dwell on concepts and to look at things, and I am not saying that we should not aspire for that. But at the same time, patient safety is an issue right now. It is an ongoing issue. Right now, thousands of patients right now, even at this moment, they are being treated in thousands of healthcare establishments all over Pakistan. So we have to start right now. And the best way to start is to understand the fact that we should bite only that much that we can chew.
Now is the time. We need to make patient safety number one priority. Patient safety is an important element of effective and efficient healthcare systems with patient-centric approach. Strong healthcare teams reduce infection rates, put checks in place to prevent mistakes, and ensure strong lines of communication between hospital staff, patients, and families. It is of utmost importance for Pakistan to address the serious issue of preventable medical errors and to come up with the solutions.
We started the journey at Riphah University in Pakistan, and Riphah University, which led the medical education journey in Pakistan, started this initiative also. And it was around 4 years back when we had formal conversations. And as Hassan Saab mentioned, that there were some efforts, but we thought that formally we should take strong measures to take this forward. And we decided on two things. One, that we will organize an international conference, which was a major undertaking. But alhamdulillah, we had faith in Allah subhanahu wa ta'ala and we had confidence in our team. And the second, we committed ourselves that we will establish an institute. And these two organized efforts will inshallah drive the patient safety journey in Pakistan, which was a major undertaking at that time. Organizing a conference here would not have been possible if it weren't for the personal involvement and support of General Khalid Nabi Sahab. So thank you very much, sir. So I look forward to see all of you, inshallah, at the 4th International Conference on Patient Safety.
All my success we are going to do and to do the correct and before we make it to something.
Nurses are integral frontline practitioners because they have essential and significant knowledge of patient history, needs and responses.
It is absolutely important that I only sat in on the end of this session, but anything that you can do to raise the awareness and make everybody else aware of the importance of the role that nurses play in keeping the health system functioning, and as it applies to patient safety, that there are so many things that need to happen. Nurses need to be respected and appreciated and listened to.